हेलो गाइड, मैं अरुण कुमार चौधरी नर्सिंग इंस्टीट्यूट। आज हमारा टॉपिक हुआ इमेज बेस्ड क्वेश्चन। यदि वीडियो आपको अच्छा लगे तो चैनल को लाइक, शेयर और सब्सक्राइब जरूर करें। इसी के साथ आज का अपना टॉपिक स्टार्ट करते हैं। आइडेंटिफाई द इमेज। आइडेंटिफाई द इमेज। राइट आंसर होगा गुडेल एयरवे। गुडेल एयरवे। This photograph used in. This photograph used in. तो राइट आंसर होगा टू ट्रीट एम्बोलिज्म। टू ट्रीट एम्बोलिज्म। नेक्स्ट, आइडेंटिफाई द इमेज। राइट आंसर होगा कोलोस्टोमी बैग। नेक्स्ट, आइडेंटिफाई द इमेज। राइट आंसर होगा लेरिंगोस्कोप। नेक्स्ट, आइडेंटिफाई द इमेज। राइट आंसर होगा मैग्जिल फोर्सेज। मैग्जिल फोर्सेज। आइडेंटिफाई द इमेज। राइट आंसर होगा ईटी ट्यूब, एंडोट्रेकियल ट्यूब। एंडोट्रेकियल ट्यूब। आइडेंटिफाई द इमेज। आइडेंटिफाई द इमेज। राइट आंसर होगा LMA, लेंजर मास एयरवे। नेक्स्ट, आइडेंटिफाई द प्रोसीजर। राइट आंसर होगा पेरिटोनियल डायलिसिस। नेक्स्ट, आइडेंटिफाई द इमेज। हैंड टिल्ट चिन लिफ्ट मैन्यूवर। आइडेंटिफाई द इमेज। राइट आंसर होगा यूरोमीटर। आइडेंटिफाई द इमेज। राइट आंसर होगा ग्लोट्रिक्शन। ग्लोट्रिक्शन। नेक्स्ट, आइडेंटिफाई द इमेज। राइट आंसर होगा आइडेंटिफाई द ट्रिक्शन। राइट आंसर होगा प्रिकॉशंस हैमर। आइडेंटिफाई द इमेज। राइट आंसर होगा ब्लड ट्रांसफ्यूजन। शो पोजीशन गिवन इन विच द फॉलोइंग कंडीशन। GERD, गैस्ट्रोइसोफेगल रिफ्लेक्स डिजीज। राइट आंसर होगा GERD। तो ये पोजीशन होती है इसके अंदर। नेक्स्ट, आइडेंटिफाई द इमेज। राइट आंसर होगा इन्फ्यूजन पंप। आइडेंटिफाई द इमेज। राइट आंसर होगा डायलिसिस कैथेटर। आइडेंटिफाई द इमेज। आइडेंटिफाई द इमेज। राइट आंसर होगा ऑक्सीजन हुड। आइडेंटिफाई द इमेज। राइट आंसर होगा जाउट्रेस्ट मैन्यूवर। जाउट्रेस्ट मैन्यूवर। आइडेंटिफाई द इमेज। राइट आंसर होगा VT, वेंट्रिकुलर टेकिकार्डिया। वेंट्रिकुलर टेकिकार्डिया। आइडेंटिफाई द इमेज। राइट आंसर होगा VP, वेंट्रिकुलर फिब्रिलेशन। आइडेंटिफाई द इमेज। राइट आंसर होगा एट्रियल फ्लैटर। एट्रियल फ्लैटर। आइडेंटिफाई द इमेज। राइट आंसर होगा कैप्ट मेडुसेक। कैप्ट मेड। आइडेंटिफाई द इमेज। राइट आंसर होगा कैट पाउ डिटेक्टर। कैट पाउ डिटेक्टर। नेक्स्ट, आइडेंटिफाई द इमेज। राइट आंसर होगा EVD सेट। EVD सेट। EVD फुल फॉर्म होगी एक्सटर्नल वेंट्रिकुलर ड्रेन। एक्सटर्नल वेंट्रिकुलर ड्रेन। और ICT EVT क्या होती है? EVT एक्सटर्नल वेंट्रिकुलर ड्रेन। एक्सटर्नल वेंट्रिकुलर ड्रेन, EVD सेट। नेक्स्ट, आइडेंटिफाई द इमेज। राइट आंसर होगा एनोक्सोप्रिन। एनोक्सोप्रिन। Which of the following waste discard following bin? Blood bag. Identify the image. Right answer biohazard. Identify the image. Right answer PMO line. PMO line. PMO line. PMO equal to pressure ventilation monitoring line. Pressure monitoring line. Next. Identify the image. Right answer Kenker catheter. Identify the image. Identify the image. Right answer होगा Lancet. Identify the image. Right answer tuberculosis. Identify the image. Right answer होगा Lentex injection. Lentex injection. Next. Identify the image. Tuberculosis. Sorry. And identify the image. Pneumonia. Identify the image. Right answer होगा Williams airway. Williams airway. Next. Identify the cannula. 18G green color. Identify the image. Right answer होगा Behrman's airway. Behrman airway. Next. Identify the image. Right answer होगा NPA airway. NPA nasopharynx airway. Next. Identify the position. Right answer होगा ring bed position. Identify the image. Right answer होगा TT tube. Next. Identify the image. Right answer होगा ET tube. Identify the image. Right answer होगा pediatric set. Identify the image. Right answer होगा Bell palsy. Identify the image. Right answer होगा transducer CV. Transducer CV. Identify the image. Manual defect. Manual defibrillator. Next. Identify the image. Identify the image. Right answer होगा myelogram. Identify the image. Right answer होगा BMP needle. BMP needle. Basic metabolic. Pen number. Basic metabolic BMP needle. Basic metabolic ANM. Next. Identify the image. Right answer होगा biopsy gun. Identify the image. Identify the image. Biopsy gun. Identify the image. Identify the image. Right answer होगा LMP needle. Number punctured needle. Identify the image. Epidural needle. Epidural needle. Identify the image. Identify the image. Dunlop traction. Dunlop traction. Identify the image. Cardiac monitor. Identify the image. ECG machine. Identify the image. Plasma pheresis. Identify the image. Radiant warmer. Identify the image. Phototherapy. Identify the image. Right answer, ventilator. Identify the image. Right answer, hemodialysis. Identify the image. Ultrasound. Identify the image. Vein circuit. Identify the image. Right answer, Venturi circuit. Identify the image. Right answer, HME filter. HME filter. HME का फुल फॉर्म क्या होता है? हीट एंड मॉइस्चर एक्सचेंज फिल्टर. Identify the image. Tunicon. Identify the image. Right answer, ICD set. ICD set. Next. Identify the image. Right answer, PEG tube. PEG tube. Pericutaneous endoscopic gastrostomy. Pericutaneous endoscopic gastrostomy tube. Identify the image. Right answer, SV tube. SV tube. Sangestan Blackmer tube. Identify the image. 14FNG tube. Identify the image. Right answer होगा nasal cannula. Identify the image. Right answer होगा bed cradle. Next. Identify the image. Right answer होगा propofol injection. Next. Identify the supply. Right answer होगा ICD set. Identify the image. Right answer होगा TM thermometer. Identify the image. Right answer होगा changing colostomy. Identify the image. Right answer होगा face mask. Identify the image. Right answer होगा nebulizer mask. Identify the image. Right answer होगा nebulizer. Identify the image. Right answer होगा NRB mask. NRB mask. NRB non-rebreather mask. Identify the image. Right answer होगा bed cradle. Identify the image. Right answer होगा footboard. Identify the image. Right answer होगा trapeze bar. Trapeze bar. Identify the image. Right answer होगा steam inhaler. Steam inhaler. Identify the image. Right answer होगा spirometry. Spirometry. Identify the image. Fumigation machine. Fumigation machine. Identify the image. Right answer होगा suction machine. Identify the image. Right answer होगा ABG machine. Airway breathing as ABG machine. Identify the image. Right answer होगा portable X-ray machine. Portable X-ray machine. Identify the image. Right answer होगा temperature probe. Identify the image. Right answer होगा VS therapy. VSC therapy. VSC थ्रेसी। VSC का वैक्यूम एसिटेड हेलोजर, वैक्यूम एसिटेड हेलोजर। नेक्स्ट, आइडेंटिफाई द इमेज, राइट आंसर होगा डेवोल ड्रेन, डेवोल ड्रेन। आइडेंटिफाई द इमेज, पेनरोज ड्रेन, पेनरोज ड्रेन। Following condition nail occur due to, following condition nail occur due to chronic hypoxia. Following condition mainly seen in psoriasis, psoriasis. Following death triangle used for trauma patient. Identify the image, phlebitis, phlebitis. Feeder with long nipple used for baby with cleft plate. Identify the image, right answer होगा ET CO2 monitor, ET CO2 monitor. Identify the image, right answer होगा AED, AED, automated external defibrillator, automated external defibrillator. Which of the following position in a patient with vasovasal synocope, Trendelenburg position? Identify the instrument, BP handle. What is the name of this maneuver? GMCH maneuver. Identify this instrument, stethoscope. Which position demonstrating RE? Right answer recovery position. Identify this instrument, backbook forceps. Identify this instrument, ET cup pressure, ET cup pressure. Identify the abnormal ECG finding, ST segment elevation. Identify this sample bottle, blood culture bottle. Identify this machine, infant incubator, infant incubator. Identify this item, this image, laryngeal mask airway, laryngeal mask airway. Identify this image, identify this image, needle holder. Identify this image, DVD circuit, Pentile compressive device, pentile compressive device. Identify the image, right answer laminar FVW, laminar FVW. Next, identify the image, identify the image, cans. Identify the image, right answer was 7-gang catheter. Next, identify the image, right answer was chemoport. Next, identify the image, next, right answer was Malfont catheter. Identify the image, right answer was sinus tachycardia, sinus tachycardia. Next, identify the image, right answer was Chittal forceps. Identify the image, right answer होगा dialysis catheter. Identify the image, right answer होगा Saint Blackmore tube, Saint Blackmore tube. Identify the image, राइट आंसर होगा इंट्रावेनस कैनुला 16G साइज, इंट्रावेनस कैनुला 16G। आइडेंटिफाई द इमेज, राइट आंसर होगा म्यूकस एक्सट्रैक्टर। आइडेंटिफाई द इमेज, राइट आंसर होगा डबल ल्यूमन एंडोट्रेकियल ट्यूब। आइडेंटिफाई द इमेज, राइट आंसर होगा रोवेक ड्रेन, रोवेक ड्रेन। नेक्स्ट, आइडेंटिफाई द इमेज, राइट आंसर होगा डाइफ्रेमी मशीन, डाइफ्रेमी मशीन। नेक्स्ट, आइडेंटिफाई द इमेज, राइट आंसर होगा PICC कैथेटर, PICC कैथेटर, PICC कैथेटर। नेक्स्ट, आइडेंटिफाई द इमेज, डायफ्राम। आइडेंटिफाई द इमेज, राइट आंसर होगा BIP, BIP, बाई लेवल पॉजिटिव एयरवे प्रेशर, बाई लेवल पॉजिटिव एयरवे प्रेशर। नेक्स्ट, आइडेंटिफाई द इमेज, राइट आंसर होगा डोवेन डिटेक्टर, डोवेन डिटेक्टर। आइडेंटिफाई द इमेज, राइट आंसर होगा कार्डियक मसल्स। आइडेंटिफाई द इमेज, राइट आंसर होगा माइक्रोस्कोप। आइडेंटिफाई द इमेज, राइट आंसर होगा माइटोकॉन्ड्रिया। आइडेंटिफाई द इमेज, राइट आंसर होगा इथोसाइट। नेक्स्ट, आइडेंटिफाई द इमेज, आइडेंटिफाई द इमेज, राइट आंसर होगा ऑपरेंट कंडीशनिंग लर्निंग। आइडेंटिफाई द इमेज, राइट आंसर होगा रो क्रैश लिंक ब्लड टेस्ट। नेक्स्ट, आइडेंटिफाई द इमेज, राइट आंसर होगा मास हिस्ट्री नीड्स, मास हिस्ट्री नीड्स। नेक्स्ट, आइडेंटिफाई द इमेज, राइट आंसर होगा सिनेप्सिस। आइडेंटिफाई द इमेज, राइट आंसर होगा पेम्बिगस वेलिग्रिस, पेम्बिगस वेलिग्रिस। नेक्स्ट, आइडेंटिफाई द इमेज, राइट आंसर होगा डेक्री ब्रेथ, डेक्री ब्रेथ। आइडेंटिफाई द इमेज, राइट आंसर होगा VP सेंस, VP सेंस, वेंटिकुलर वेंटिकुलर VP सेंस वेंटिकुलो पेरिटोनियल, वेंटिकुलो पेरिटोनियल। नेक्स्ट, आइडेंटिफाई द इमेज, राइट आंसर होगा होमन साइन, होमान साइन, सॉरी होमान साइन। आइडेंटिफाई द इमेज, राइट आंसर होगा डिप्लोपिया। नेक्स्ट, आइडेंटिफाई द इमेज, राइट आंसर होगा माइटोसिस, माइटोसिस। नेक्स्ट, आइडेंटिफाई द इमेज, राइट आंसर होगा डेक्स्ट्रोकार्डिया, डेक्स्ट्रोकार्डिया। नेक्स्ट, आइडेंटिफाई द इमेज, राइट आंसर होगा टेट्रोलॉजी ऑफ फैलोट, टेट्रोलॉजी ऑफ फैलोट। नेक्स्ट, आइडेंटिफाई द इमेज, राइट आंसर होगा कोरोनरी आर्टरी। आइडेंटिफाई द इमेज, राइट आंसर होगा कार्डियक स्ट्रेस टेस्ट। आइडेंटिफाई द इमेज, राइट आंसर होगा वेंटिकुलर असिस्टिव डिवाइस, वेंटिकुलर असिस्टिव डिवाइस। नेक्स्ट, आइडेंटिफाई द इमेज, राइट आंसर होगा IABP, IABP। IABP, इसका आंसर होगा Identify the image. IABP. Next. Identify the image. Right answer होगा atrial fibrillation. Atrial fibrillation. Next. Identify the image. Ventricular viriditation. Ventricular viriditation. Next. Identify the image. Right answer होगा atrial flutter. Identify the image. Right answer होगा ventricular tachycardia. Ventricular tachycardia. Identify the image. Right answer होगा premature ventricular contraction. Premature ventricular contraction. Identify the image. Right answer होगा heart-lung machine. Heart-lung machine. Identify the image. Right answer होगा automated external defibrillator. Identify the image. Right answer होगा ventilator. Identify the image. Right answer होगा pulse oximetry. Identify the image. Right answer होगा PFG machine. PFG machine. Percutaneum fluoroscopic gasterotomy. Fluoroscopic gasterotomy machine. Identify the image. Thyroid gland assessment. Identify the image. Central venous catheter. Identify the image. Right answer होगा tongue depressor. Identify the image. Right answer होगा Ryle's tube. Identify the image. Right answer होगा PTCA balloon dilation catheter. PTCA balloon dilation catheter. Identify the image. Right answer होगा Bilirubin first. Identify the image. Bilirubin second. Identify the image. Right answer होगा gastric lavage. Identify the image. Right answer होगा Tostic sign. Identify the image. Right answer होगा pulmonary valve stenosis. Identify the image. Right answer होगा Swampscott culture tube. Identify the image. Right answer होगा cellulitis. Identify the image. Right answer होगा high power position. Identify the image. Otoscope. Identify the image. Right answer होगा male metal catheter. Identify the image. Right answer होगा suprapubic catheter. Suprapubic catheter. Next. Identify the image. Right answer होगा EEG. EEG electrocardiography. Electroencephalography. Next. Identify the image. Right answer होगा slit lamp. Next. Identify the image. RBS palsy. RBS palsy. Next. Identify the image. Right answer होगा McGaney biopsy needle. McGaney biopsy needle. Identify the image. Right answer होगा crenoclast. Next. Identify the image. Right answer होगा DG stent. DG stent. DG stent. Next. Identify the image. Right answer होगा transverse transvarying position. Transvarying position. Next, identify the image. Identify the image. Right answer होगा approach position. Next, identify the image. Nasal speculum. Identify the image. Ambu bag with rebreathing bag. Ambu bag with rebreathing bag. Identify the image. Laryngoscope. Laryngoscope. Identify the image. Vein circuit. Identify the image. Blood transfusion set. Identify the image. Right answer होगा chemo needle. Identify the image. Right answer होगा under 5 clinic. Identify the image. Right answer होगा potentially of vaccine. Potentially of vaccine. Identify the image. Right answer होगा vaccine barrier. Vaccine barrier. Identify the image which can be used. A and B. Identify the image reflex space with age. 3 से 4 months. 3 से 4 months. Identify the image reflex and displayed with age. Rotting reflex and 7 months. Rotting reflex and 7 months. Identify image reflex despair. Identify the image reflex despair with age. A and B. Doll's eye reflex, oculocephalic reflex. Following technique helpful and elements are for lower weight baby and skin to skin contact and excessive breastfeeding. Following image technique used for tactile stimulation breathing. Tactile stimulation breathing. Approved size of laryngoscope blade and neonatal incubation. Miller blade number 1. Miller blade number 1. Birth injury induced swelling that does not cross suture lining. So right answer होगा splenectomy. Identify the image. Right answer होगा ERBS palsy. Following equipment used for measuring weight. Measuring weight. Next. Weight measuring device expect. Infantometer. Infantometer. Following equipment used for measuring height. Measuring height. Child height measuring device expect. BIM. Identify the given condition. Hydrocephalus. Normal value of following measurement at birth given image 35 cm. closing of frontals as per given image. Anterior at 18 months and posterior at 6 to 8 weeks of age. Following milestone infants can achieve at to 9 months. Infantile play is baby response cell smiling, pointing to interactive individual. Guidance of social effective play. Total engaged with play mainly solitary and parallel play. Purpose of following device as given below. Oxygen therapy. Next, following device used for provide warm, humidify and high follow oxygen. Provide warm, humidify, high and oxygen. Nutritional deficiency as in following image due to PM, protein energy malnutrition. Following condition occur due to vitamin A deficiency. Vitamin A deficiency. Following limb deformity occurs due to vitamin D. Following clinical condition mainly in this age, 3 to 12 weeks of age. What we can do to preventing lead loss of evaporations in given age below. Cover with trial plastic sheet. Patient have with cardiac problem in following image below. Cyanotic CST. Blue or tag cells mainly seen in TOR, pathology of phalloid. Hypertension and overgrowth of upper extremity and absent or weak femoral pulse suggest with cardiac defect. Correction of aorta. Next. Following technical use for treat neonatal hyperbilirubinemia. Exchange blood transfusion method used for severe hyperbilirubinemia. Most common hypopediasis in children. Anterior hypopedias. Circumstances not choice of surgical intervention for phimosis. Rift clitoris seen in male एपिस्पेडियास इसका होगा फीमेल एपिपीडियास नेक्स्ट what nurse should do you prevent the following congenital deformity that given below from the irritation and infection. Right answer होगा B and C. Sterile dry dressing, cover with sterile plast. Which are the neural tube defect aspects? Hydrocephalus. Which one of the spinobifida defect is lead transmitter of light? Meningeal cell. What is the following procedure and its purpose? EVD and reduce increase ICP by training CSF. When the nurse checks GCS patient with head injury and found following postures in rubbing patient sternum as per motor aspect of GCS which number is given. Right answer होगा BMC. M1 M2 for decrevate, M3 for degrowth state. Post-operative positioning in the baby following repair the defect. Right answer होगा place on prone position, EFT peritoplasty. Most common congenital cleft foot is A. Identify the route of drug administration shown in the photograph. Right answer are transdermal delivery. Transdermal delivery. All artery for his route of drug administration expect. Right answer होगा all drug can be given. All drug can be given. Which is the drug of choice reducing the papillary condition as shown in the image? Atropine ointment. The drugs shown are pictured below the contraindicate in which among the following cases? All of the above. Severe heart disease, severe liver disease, severe kidney disease. All of the above. All medicine from the following can be given patients suffering from the spasmodic pain and area shown in the picture below expect. Ranitidine. The drug shown in picture below is contraindicated with among the following cases? All of the above. Asthma, slick sinus syndrome, AV block. The drug of choice for toxic form of condition shown in the photograph is? Right answer होगा propanol. A patient develop condition so in ECG intraoperatively the drug of choice in this case is? Right answer होगा propanol. Drug of choice for cases of poisoning substance shown in the photograph. Right answer होगा protamine sulfate. Muscles relax of choice for use for instrument shown in the photograph below is? Section 9 choline. The common complication of disease shown in the diagram is? Encephalophysitis. Patient with acute abdominal pain presented with following picture diagnosis: acute hemorrhagic pancreatitis. Identify the instrument shown in the image below. Right answer होगा Alice forceps. Identify the contact use of the instrument shown in the image. Right answer होगा use for direct superficially and shallow incision. Identify the use of following instrument during surgical procedure. So it use a towel clip or two clip trace. Identify the instrument shown in the image. Right answer होगा wrist and detector. Next. Identify the instrument shown in the image. Right answer होगा bandage cutting scissor. Identify the purpose of the instrument shown in the image. Right answer होगा it used for cut switcher. It used for to cut switcher. Identify the instrument of shown in the image. Right answer होगा punch holding process. Next, identify use of the following instruments shown in the image below. Right answer होगा it is used to hold needle. It used to hold needle. Identify the use of instruments shown in the image below. Right answer होगा it is used to transfer object from the surface to another in sterile way. Identify the instruments shown in the image below. Right answer होगा skin stapler. Identify use of the below shown instrument. Right answer होगा it used for during anal examination. Next, the image shown below is a wax needle. What is the S? Right answer it used to during various laparoscopic procedures to create pneumoperitoneum. Identify the instruments device shown the picture below. Scope vein set. Which measures from the following may not help to prevention of the condition as shown in the photograph. Right answer होगा aspirin. Injury signs shown in the image known as Bettel's signs. In the figure, MC burning point depicted Y. Right answer होगा blue point. Peak incidence of the condition among the children as shown in the image. Right answer होगा 3 to 9 months. All are true about instruments shown around the photograph aspect. Right answer होगा pneumoperitoneum never required. Imaging procedure as shown the photograph below is Doppler USG. Which are the following possible risks after the method shown in the picture below? Right answer होगा the pictures are below. All of the infection होगा, infection, swelling, pneumothorax, all of the above. Next, the common site of performations during the procedure shown in the picture below is sigmoid colon. Which among the following is about procedure shown in the picture below? Right answer होगा ANC. Provide endoluminal biopsy or CT and MRI use. Identify the procedure shown in the photograph below. Excisional biopsy. True about this instrument as shown in image. Right answer होगा ANC. More reliable than face mask alternative and endotracheal tube ETT. Next, the instrument used for checking airway of a patient in all the following conditions except. Right answer होगा in patient with large tumor of the oral cavity. Next, type of surgical suture shown in photograph is continuous subcutaneous. Next, Identify the instruments shown in the partograph. Right answer होगा precautions endoscopic gastrostomy tube. Type of injury shown in the partograph is crash. Procedure shown in the partograph must be done. Right answer होगा all of the above. Head injury, facial injury, neurological fixture. Most common organ injured in trauma body part shown in the partograph is. Right answer होगा liver. Sodium concentration in solution shown the photograph is. Right answer होगा 130 mq per liter. Maneuver used in trauma medicine show photograph. Right answer log rolling. Investigation of choice for measurement and complication of the condition shown in photograph below is CT scan. Identify the type of prosthetic health wall shown in the photograph. Right answer होगा by lift it and mechanical. Identify the valvular condition shown in photograph. Mitral regurgitation. Procedure shown in the photograph is chest tube drainage. Normal value of index arrow calculate method shown in the photograph is 1.0. Sand as represented by an arrow shown in the photograph below is used for cystitis. Identify the sand as shown in the picture below. Denier sand. Identify the procedure as shown in picture below. Total colostomy. Organs shown in the photograph below. The most common site all expect stress ulcer. The traditional and most reliable way to make diagnosis of the condition as shown in picture below the children is constant enema. Next question. Identify the sign represented in the picture below. So here signs. Most common site of carcinoma of organ shown in photograph is head. Reflex to arrow in photograph is scored by Demeter score. Sign around umbilical shown in photograph result from all of the above. Acute pancreatitis, blunt abdominal trauma, ectopic pregnancy. Most important marker for evaluation canal and gland shown in the photograph below is PSA. The instrument used for surgery as shown in the photograph below is useful to detect temporarily basic. Identify the instrument used in surgery and shown in the photograph below. Morris detector. The surgical instrument shown in the picture below help to all of the above. Keep the incision open. Keep the incision open and keep the skin tissue away from the bones and the organ. Work in the deep layer, performing cesarean delivery. Identify the surgical instrument. Identify the surgical instrument shown in the picture below. Ventilator detector. Identify the electrosurgical instrument shown in the picture below. Right answer होगा register. Identify the electrosurgical instrument shown in the picture below. Diastemi. Identify the medical instrument shown in the picture below. Otoscope. Otoscope. Identify the back marked by an arrow. The picture below. Right answer होगा colostomy bag. Colostomy bag. Identify the surgical instrument shown in the picture below. Aneurysm needle. Aneurysm needle. The given below device used for pneumatic compression stocking in prevention of DVT. Gas used for given cylinder. Nitrogen. Identify the area marked in below image. Anterior cuboidal fossa. Anterior cuboidal fossa. Identify the person in below image. Mark Jackbrek CHO Facebook. Identify person below image. Mark Jackbrek CHO Facebook. Identify the image that used in NICU during phototherapy. Dosimeter. Identify the clinical sign denote its image. Gauge sign. Gauge sign. Identify the image. Identify the image. Mood therapy. Mood therapy. Identify the image. Standing breath position. Spine position. Spine position. Sims posterior view. Prone. Knee chest position. Dorsal recommended position. Standing position. Sitting position. As skating or lithotomy position. Identify the image. Posture forceps. Posture forceps. Identify the image. Bridge presentation. Bridge presentation. ROP right occipito-posterior. LOP left occipito-posterior. ROT right occipito-transverse. ROA right occipito-anterior. LOA left occipito-anterior. LOT left occipito-transverse. ये posterior right, anterior और ये left. Identify the amount lochia shown in image. Moderate amount. Identify the image. Anterior fetal head monitor device. Identify the image. Bilirubin meter. Bilirubin meter. Identify the image. Equidural hematoma. Identify the image. K19 catheter. K19 catheter. Identify the image. Evade tube. Evade tube. Identify the image. Melfort catheter. Identify the image. Longan bow. Identify the image. Valianter detector. Identify the image. Bone detector. Identify the image. Tendon forceps. Identify the image. Muscles forceps. Identify the image. Ellis forceps. Identify the image. Tracheal dilator. Identify the image. Wenger forceps. Identify the image. Tube oculating forceps. Identify the image. Jones towel clamp. Following symbol drug packet denotes keep dry. Following symbol of drug packet denotes do not reuse. Following symbol drug packet denotes keep away from children. Following symbol on drug packet denotes keep away from sunlight. Following symbol drug packet denotes Cotton's concept accompanying document. Cotton's consent accompanying document. Image based. Most common site used for unilateral. Right answer A, 2 से 3 centimeter or 2 से 3 centimeter. Position provide ECT procedure. ये आंसर आपको बताना है. The given drug used for ECT. तो राइट आंसर होगा इसका it increase heart rate during procedure. Identify different one. ये आंसर भी आपको बताना है, कमेंट करना है. Which type of EPS shown image, ये भी आपको बताना है. ये भी आपको बताना है. ये भी आपको depressive patient admit psychiatric ward before starting medication. Nurse perform the shown procedure. Select the prescribed drug. इसका राइट आंसर होगा amitriptyline. This side effect with type of antidepressant. Imipramine. Next, identify given box. Ice lines refrigerator. Identify the given box. Vaccine cold box. How many vaccine can be put on ice pack during administration? Timed vaccine session 2. Identify component of cold chain. Walk in cold room. Identify the image. Right answer vasotomy. Identify the image. Right answer tuberculotomy. Identify the image. Right answer होगा वेजाइनल स्पंज. Identify the image. Right answer होगा diaphragm. Identify the image. Right answer होगा property 220. Identify the image. Silver line property. Following image type IUCD defines this Lipus loop. Identify the image. Right answer होगा female condom. Identify the image. Male condom. Identify the image. Grenzfenberg ring. Identify the image. NSV. Identify the biomedical weight symbol. Right answer G. Chemical used for disinfection cytotoxic drug and discard medicine should be collected in yellow bag. Given strips should be discarded with of the following color bag. Right answer yellow. The given bag should be discarded with distribution. Right answer होगा yellow. Orthopedic transplant plate sacro screw wire should be connect in white. The given should be discarded according to PW in which color bag? Red. Disposable tin tubing, catheter, urine bag, syringe, growth vacuum should be collected in red bag. कैचेटर ट्यूबिंग सभी किसमें आते हैं? रेड बैग के अंदर. This given syringe should be discarded in white bag. Needle from catheter, sister needle, syringe, whitefish needle should be discarded in white bag. Obstetric and gynecology. Which of the following not true about instruments shown in the image below? Right answer say it should not be used during pap smear. What is the following instrument used for? The instrument shown is uterine crater. Identify purpose of the instrument shown in the image below. It used to take pouch biopsy from the cervix. Identify the instrument shown in the image. None of the above. meiosis I. Identify the correct use of instrument shown below the image. Right answer. It used for pap smear. The uterine anomaly shown in the particular below occur as result of. Right answer होगा incomplete fusion of para-mesophoric tract. A normal, a diaphysis accurate when we commit bicuspid or septate. Uterine septum, bicurnate uterus diaphysis or N communicate uterus. In this condition, the first child separated because centralization RH negative, mother Y R positive is generally occur at birth. Identify the type of pelvic prolapse shown in the photograph. Uterine prolapse. Clinical examination shown in the photograph used to detect ascites. Identify the type of pelvic prolapse marked in narrow arrow shown in the photograph below. Cytocell. The device shown in the picture below the ideally inserted at just after menstruation. Recommended method use pill shown in the photograph is 0.75 and is 2 pills 1+1 4 hours apart. Unwanted reprogressor. Identify instruments shown in the picture below. Wax fiction ring forceps. Which of among the following the most of common side effects contraceptive shown in the photograph below? Right answer होगा bleeding. Gynecological procedure shown in the photograph is pap smear. Identify the device instrument shown in the photograph below. Hanger cervical dilator. Identify the device shown in the picture below. Colposcope. Clinical sign being elected in the photograph below the known as Cantor sign. Still point. A positive clinical sign being the elected the photograph below the represent all of the above: abdominal hernia, abdominal wall of hematoma, tip syndrome. Identify the device instrument shown in the photograph. Dowen's detector. Identify the device instrument shown in the photograph. Diverse detector. Saprometic spectral walk within shown in the photograph is needle piece. Largest diameter in fetal scale of photograph is 3. Cell cleavage type of embryo shown in the photograph is blastocyte. blastocytes. Identify the type of placenta accretion shown in the image. Circummarginate. Implantation of cell cleavage type in 8. Identify the placental conditions shown in the picture below. Placenta previa. Cell cleavage type in embryo shown in the photograph below is morula. Embryo proper is a delivered which part of the cell cleavage type in embryo shown in the photograph below. Inner cell mass. Pelvic shape type as shown photograph is patelloid, patellopelloid. Pelvic shape type as shown in the photograph is android. Clinical signs shown in the photograph below is known as Hanger signs. Diagnose the signs shown in the picture below. External allotment. The green color marked in pelvic shown in the picture below represent false pelvic. Drug supplementation as shown photograph below. The pregnancy prevent which among the following fetus neural tube defect. Drug supplementation as shown the picture below. The given during which trimester pregnancy first. Maneuver shown in the photograph below is known as repropated maneuver. Fetal presentation as shown in the photograph below known as bridge presentation. The chief cause of the parental mortality in the type of fetal life shown in photograph below is intracranial hemorrhage. Fetal attitude as shown in the photograph is known as extend. Identify the fetal attitude shown in the picture below. Vertex. Uterine size as represented by sagging black line from bottom in the picture below. The represent gestation age of 12 weeks POG. Fetal position as shown in the photograph below is known as left occipito anterior. ये वही ROP right occipito posterior, left occipito posterior, ROT right occipito transverse, ROA right occipito anterior, LOT left occipito transverse और LOA left occipito anterior. Type of maternal anemia based on photograph peripheral streamer represent below is sickle cell anemia. Which among the following the most common site of the condition fallopian tube shown in the picture below? Ampulla. Type of epiphytoplacenta shown in the photograph below is marginal separations. The condition shown in the picture below is characterized by all the following aspects present in the first trimester. Ideal management of a 37-week pregnant elderly primigravida with conditions shown in the picture below and active bleeding is cesarean section. Maneuver shown in the photograph note then is PIS. Identify the graph shown in the photograph used for during labor. Partogram. Position shown in the photograph below the increased vaginal opening by 2 cm. Stage of labor process shown in the photograph is third stage. Below given for type of delivery shown in photograph: pudendal, pudonadal. Maneuver shown in the photograph is known as Smile weight maneuver. Method shown in the photograph can detect fetal cardiac activity by 5 to 6 week POG. Identify the instruments shown in the photograph: umbilical scissor. Parental diagnostic procedure shown in the image can be done with period of gestation 10 to 12 weeks. The instruments shown below are used for what procedure? Dilation and curettage. Identify the instruments shown: episiotomy scissor. Identify is given procedure done labor room. राइट आंसर होगा NST. ओके गाइड, यदि आपको वीडियो अच्छा लगे तो चैनल को लाइक शेयर व सब्सक्राइब ज़रूर करें. फिर मिलते हैं कुछ अच्छे वीडियो के साथ. तो आपसे फिर रिक्वेस्ट है कि चैनल को सब्सक्राइब करें, लाइक करें, शेयर करें और कमेंट करें, ताकि हम आपको कुछ और एजुकेशन वीडियो प्रोवाइड करवा सकें. इसीलिए ज़्यादा से ज़्यादा शेयर करें, लाइक करें और सब्सक्राइब करें आपको, और बेल आइकन को भी प्रेस करें ताकि आपको नेक्स्ट नोटिफिकेशन मिले तो आपको पता चले. ओके गाइड, फिर मिलते हैं कुछ अच्छे वीडियो के साथ.